Hello, my name is Claire Pomeroy. I am president of the Lasker Foundation and serve as chair of the awards committee for the Beyond Flexner Alliance. I welcome all of you to a very special part of our program, the bestowing of the Josiah Macy Jr. Foundation Awards for Excellence in Social Mission. We thank the Macy Foundation for their support of this program. This year's nomination process was highly competitive, with nearly double the number of submissions we had in 2018. The awards are given in 5 categories, including a new category, recognizing an early career rising star. You will hear more about the honorees' work during their presentations, but I'd like to give you a quick preview. Dr. Robert Rock is the winner of the 2021 Rising Star Award. He co-created an innovative interprofessional course at Yale University on health disparities that prepares learners for action toward health equity. His efforts help create a sense of belonging and empowerment for students who carry identities traditionally underrepresented in medicine. Dr. Joseph Kiesler is the winner of the 2021 Award for Individual Excellence. From providing care to the homeless, to his leadership in establishing a national model of interprofessional service learning at the University of Cincinnati College of Medicine, Dr. Kiesler is a true champion of the core values of social mission. The Green Family Foundation Neighborhood Health Education Learning Program at Florida International University is the winner of the 2021 Award for Program Excellence. Neighborhood Health demonstrates national leadership in integrating social accountability and interprofessional education through a service learning experience in underserved communities. Charles R. Drew University of Medicine and Science is the 2021 Institutional Awardee and is a beacon of hope for students who wish to pursue a career in health professions and advocate for those whose voices are too often not heard. Formed from the ashes of the Watts riots in 1966, Charles Drew has a mission of academic excellence coupled with community responsibility. And Dr. George Blue Spruce Jr. is the 2021 awardee in the Lifetime Achievement category. Dr. Blue Spruce is the first Native American dentist in the United States and has created a legacy of illuminating health professions' career pathways for Native American children who are often unaware that these options exist. So on behalf of the awards committee and the Beyond Flexner Alliance, here are the 2021 Josiah Macy Jr. Foundation awardees for excellence in social mission.
Robert Rock entered medical school to use medicine as a means to achieve justice, and in each arena of his life brings interprofessional social mission to the forefront. As a first-year medical student at Yale, Robert identified glaring absences of curriculum on health and equity, which led him to create campus-wide innovations. In 2013, Robert partnered with a classmate to create the U.S. Health Justice Elective, a one-of-a-kind course on health disparities for PA, MD, and APRN programs. The course intentionally includes interprofessional educators that range from patient advocates, community leaders, art educators, psychologists, and lawyers, among others. The USHJ has now been incorporated into the main curriculum at Yale. The USHJ elective successes led to the creation of the USHJ Collaborative, an interdisciplinary, award-winning student group for all graduate students, faculty, and the New Haven public for community building, radical learning, and action toward health equity. Robert's profound legacy also led Yale to create the Robert Rock and Tareem Riemann Student Activism Award, given annually to graduating medical students who challenge the status quo and work toward social mission. Currently at the residency program in social medicine at Montefiore, Robert has already successfully pushed for social mission in health professions education by collaborating with residents of color to reform the first-year social medicine immersion month curriculum. Reforms include structural competency, critical race theory, and intersectionality into the goals and objectives in ways that force trainees to reevaluate their humanity and relationship to the communities in which they train. Robert Rock's recognition of the humanity, inherent worth, and ability of everyone he interacts with informs his steadfast commitment to collaboration. In order to elevate the worth and ability of everyone around him, Robert tries to dismantle the walls of division within health professions education and build equitable collaborations between academics and the communities they intend to serve. Dr. Rock's efforts have helped to create a sense of belonging and empowerment for students who carry identities traditionally not exemplified in medicine.
Dr. Joseph Kiesler is a family physician in the Department of Family and Community Medicine at the University of Cincinnati College of Medicine. He champions the social mission of health professions education through his inspired commitment to health equity in teaching, clinical work, and leadership. Joe's Medicaid Assistance and Technical Policy Program, MedTAP, has expanded the clinical curriculum to include monthly care conferences focused on interprofessional education principles and team-based care. This work led to an award of 2 HRSA primary care training and enhancement grants. These efforts combined have impacted over 1,000 advanced practice nurses, physician assistants, physicians, health professions students, community agencies, social workers, and front office staff that provide care to the poor and underserved. Dr. Kiesler founded a racetrack clinic, providing basic health care for 250 workers and their families who live and work at the racetrack, providing over 2,200 free medical services and serving as a national model. Volunteer students, faculty, and staff treat chronic and acute health problems, including trauma, mental health, substance abuse, and provide preventive care. At the UC College of Medicine, Joe implemented the first service learning curriculum focusing on health disparities and a student service learning advisory council led by interprofessional faculty. He established partnerships with over 25 social service community agencies in the greater Cincinnati area to co-create solutions addressing health-related social needs. He helped create virtual reality tools for providers and learners, and with the help of a student, developed an app for community resources widely used by individuals and community agencies. The UC Open School Clinic, a free student-led interprofessional clinic for health promotion and prevention, was co-founded by Dr. Kiesler and draws students from all UC Academic Health Center colleges. Joe Kiesler is a true servant leader and a champion of the social mission of interprofessional education. We are happy to honor Dr. Joseph Kiesler with the Josiah Macy Jr. Foundation Award for Individual Excellence in Social Mission and Health Professions Education.
I wish to thank the Josiah Macy Jr. Foundation and Beyond Flexner Conference for this award, honoring the work of our students, our community partners, and also the faculty at the University of Cincinnati College of Medicine. Although this award says individual, there was nothing individual that went into having our students and learners partner with the community to address the terms of health. Also wish to thank our community members who were mentors and really teaching our learners how to address and improve the health of the community. Also wish to thank my mentor, Dr. Barbara Tobias, who nominated me for this award and really helped teach me how to be an advocate and partner with the community to improve health equity. I hope you have a wonderful conference, and I look forward to meeting you someday in person. Have a great afternoon. Thanks.
The Josiah Macy Jr. Foundation Award for Program Excellence in Social Mission and Health Professions Education honors the Green Family Foundation Neighborhood Health Education Learning Program, Neighborhood Help at Florida International University, Herbert Wortham College of Medicine. Neighborhood Help creates longitudinal interprofessional teams of medical, nursing, social work, physician assistant, and law students to improve health outcomes and increase access to care for households in Miami-Dade County, Florida. The program emphasizes learning about and addressing the social determinants of health to improve the well-being of underserved communities. Over 3 years, students work in interdisciplinary teams, providing household-centered care and developing care plans to improve the health and quality of life of community members. Neighborhood Help aims to enhance primary and preventive services by connecting uninsured household members to healthcare services through mobile health centers at community sites. Neighborhood Help incorporates 4 mobile health centers and provides a broad range of integrated primary, preventive, and behavioral health services. Data through March 31st, 2021 includes 2,649 medical, nursing, social work, physician assistant, and law students conducted 13,891 visits, including virtual, to 1,214 households with 3,372 members. In response to COVID-19, 588 patients received health services during 3,488 telemedicine consultations. Since 2012, 5,865 patients received health services through the Neighborhood Help mobile health centers during 24,833 visits, including 4,932 screening mammograms. FIU Neighborhood Help changes the conversation of health from a purely medical one to a discussion that includes the deeper issues and determinants of the health of a household. The Neighborhood Help leadership team includes David Brown, interim chair of the Department of Humanities, Herbert Wortham College of Medicine; Maria de los Santos, leading nursing faculty, Nicole Wortham College of Nursing and Health Sciences; Onelia Lage and Gregory Schneider, lead medical faculty, Herbert Wortham College of Medicine; Lourdes Martin, lead social work faculty, Robert Stemple College of Public Health and Social Work; and Danny Lozano, lead faculty, physician assistant studies, Herbert Wortham College of Medicine. Additionally, while at FIU, Dr. Joe Greer led the team that created, implemented, and oversaw Neighborhood Help. He is currently the Dean of the New College of Medicine at Roseman University of Health Sciences.
On behalf of the entire Neighborhood Help family, I want to thank the Josiah Macy Jr. Foundation and Beyond Flexner Alliance for this award in program excellence for social mission and health professions education. Since its inception, Neighborhood Help has been based on the idea of reducing the distance between underserved households and health profession students. This is truly a team effort involving colleges of medicine, social work, nursing, public health, law, and engineering, extensive outreach team, more than 150 community partners, and interprofessional students, faculty, and residents, as well as household members themselves. Our program is based on developing longitudinal relationships with households, meeting them where they are, and focusing not just on disease management, but on fostering the social foundations necessary for health. I want to make a special thanks to our founding visionary leaders, John Rock, Joe Greer, and Lou Brewster, who set us on this course. We are very grateful to the Josiah Macy Jr. Foundation and the Beyond Flexner Alliance for highlighting this very important issue and for your commitment to social mission and health professions education. Thank you very much.
The Josiah Macy Jr. Foundation Award for Institutional Excellence honors Charles R. Drew University of Medicine and Science. Charles R. Drew University of Medicine and Science is a private, nonprofit, community-founded, student-centered university committed to cultivating diverse health professions leaders who are dedicated to social justice and health equity for underserved populations through outstanding education, clinical service, and community engagement. The university was founded after the Watts Rebellion of 1965, partially as a response to the lack of access to healthcare and education in South Los Angeles. The institution was chartered in 1966 in Los Angeles, California, with a strong commitment to eliminating health disparities as a core value. 3 schools and colleges are housed on the campus: the College of Science and Health, the College of Medicine, and the Mervyn M. Damali School of Nursing. In 2015, Brookings Institute published a report ranking 4-year colleges that generate the highest value added with respect to occupational earning power. Among 4-year colleges, Charles R. Drew University of Medicine and Science ranked in the top 3. The Almanac of Higher Education, published annually by the Chronicles of Higher Education, ranked CDU as the second most diverse private nonprofit college in the nation. Nominated by one of their alumni for this award, Charles R. Drew University of Medicine and Science is seen as a beacon of hope, particularly for students from under-resourced communities themselves who wish to pursue a career in health professions and advocate for those whose voices are silenced. CDU has graduated, since its inception, more than 700 physicians, 1,225 physician assistants, and over 1,000 other health professionals, as well as training over 2,700 physician specialists through its sponsored residency programs. Its School of Nursing has graduated over 1,300 nursing professionals, including over 950 family nurse practitioners. CDU is a leader in health disparities research with a focus on education, training, treatment, and care in cancer, diabetes, cardiometabolic diseases, and HIV/AIDS. This historically Black graduate institution continues to evolve, serving the healthcare needs of under-resourced communities in Los Angeles, as well as throughout California and the entire country.
Greetings. On behalf of the entire CDU family, our trustees, faculty, staff, and especially our students, as well as the community we serve, I am deeply honored to accept this 2021 Josiah Macy Jr. Foundation Award from the Beyond Flexner Alliance in the category of Institutional Excellence. Just the title of that category makes it very special for us because at CDU, we strive for excellence in all our programs. We are also honored to accept this award with the other most deserving recipients and from the Beyond Flexner Alliance, an organization that is focused, much like CDU, on promoting and achieving health equity. This has been a most difficult year for everyone in healthcare, but I've been heartened by the attention the COVID-19 pandemic has brought to the issues of health equity and health disparities. I've also been inspired by the courage so many healthcare professionals have demonstrated in the fight against COVID-19, including those who have worked so hard to bring resources, testing, medical care, and vaccinations into the under-resourced communities of color who have been so affected by the pandemic. There are countless institutions in our field who have demonstrated excellence this year, and I am grateful to the Beyond Flexner Alliance that you chose CDU from among them to receive this award. Thank you again.
The unique leadership of Dr. George Blue Spruce left a national and international legacy promoting social mission in health professions education. He is the nation's first American Indian dentist, a retired assistant surgeon general who provided care to his pueblo and other native people. He earned a master's in public health from Berkeley and was the director of an Indian health service area. He has dedicated his life to the development of a reflective health workforce. Dr. Blue Spruce provided care to those in need, addressed the social determinants of health, reduced health disparities, and taught others to do the same. After serving and providing care in the Navy, he transitioned to the United States Public Health Service. His first assignments were with the Indian Health Service, where he cared for remote communities, utilizing portable systems to take into New Mexico reservation schools and remote Montana communities. Underserved Indian communities at that time were leery of oral health care, so he embarked on a speaking campaign to help foster an understanding of the importance of oral health as an integral and integrated part of overall health. Dr. Blue Spruce established systems to promote health professions' workforce diversity and equality that are still in place today. He was the first director of the Office of Health Manpower, funding universities, recruitment of minorities, women, and the underserved into health profession schools. He drafted the legislation for Title I of the Indian Health Care Improvement Act, providing scholarship programs for health profession students. As Dr. Blue Spruce's career matured, he served as a public health service leader in D.C. In his positions there, he was an originator and implementer of ideas and programs to address health professions, university admissions, and processes designed to improve diversity, cultural proficiency, and successful matriculation. He also founded the Society of American Indian Dentists, served in its leadership, and organized the student section. Throughout his career, George has maintained the understanding that as a trailblazer, he bears the responsibility of illuminating the health profession's pathway for American Indian children who are unaware that the path exists. His unique leadership has left a national and international legacy promoting social mission in health professions education.
Hello, my name is Dr. Holly Humphrey, and I am the president of the Josiah Macy Jr. Foundation. I hope that you have enjoyed hearing a bit about the incredible work being done by the 2020 recipients of the Macy Foundation Awards. At the Foundation, we are interested in transforming the clinical learning environments for current and future health professionals in 3 areas: diversity, equity, and belonging in our clinical learning environments, increasing interprofessional team-based collaboration, and preparing learners to navigate the complex ethical dilemmas that they encounter in the clinical learning environment. The awardees you've heard from today represent success stories from all of these high aspirations. These awards were the brainchild of Dr. Fitzhugh Mullen and the immediate past president of the Macy Foundation, Dr. George Thibault. They created these awards in order to recognize outstanding leadership in promoting the social mission in health professions education. Social mission is defined as activities or initiatives that teach, model, or improve community engagement, diversity, value-based care, or engagement with the social determinants of health. As Fitzhugh Mullen said in his 2017 JAMA article, and now I'm quoting, "Social mission is about making health not only better, but fairer, more just, reliable, and universal." End of quote. This awards program is our opportunity to help honor those who have advanced the social mission and who serve to inspire all of us to make the changes needed in health professions education to ensure that the next generation has the skills needed to fulfill the responsibilities of our professional contract with society. We will be officially presenting the awards in person in 2022 at the Beyond Flexner Conference in Phoenix, Arizona, in a special ceremony on March 28, 2022. I am pleased to announce that we will be taking nominations for the 2022 awards starting early this fall. If you have a nominee in mind, please consider preparing the nomination and submitting it to us for review. Fitz always referred to the in-person ceremony as the Academy Awards for Social Mission, and we hope to be able to bring that to Phoenix in 2022. I look forward to seeing you there. Until then, be well and stay safe.